I'm super excited to be here. It's one of my first outings since the pandemic, and so it is amazing to see faces. And so I want to say thank you to your commitment to actually being here in person and not doing one more of these things virtually. I am so zoomed out, as I'm sure everybody is. My name is Kevin. Like most of you, I play a lot of different roles in my professional life. I'm a professor at Carlow University in Pittsburgh, small private university where I teach a course that I designed for sociology, psychology, education, special education, and it's a course on the intersection of arts and disability. I'm a subject matter expert and Fulbright specialist for the State Department on arts integration for special populations, which is a really fun job, takes me to some very cool places. I'm a research consultant at the University of Alabama, Birmingham in their occupational therapy program and in their Institute for Arts and Medicine. I am the director of a small organization called Center for Creative Arts, which is really dedicated to bringing the arts into medicine and to education. But my most fun job, and probably the most interesting of all of those, is I'm a professional magician. That's what I do, which is always really interesting. My wife and I actually toured the world with one of the largest and most successful touring illusion shows in the US. That meant almost every night, somewhere on the planet, I had the opportunity to take my audiences on the journey to the brink of impossibility. And sometimes we brought them back. I got to see the world from some of the most amazing stages. We toured throughout the United States, never made it to Alaska, just cold. And so I never made it to Alaska, but we did 49 states and 34 countries with a magic show. So it was really cool. I've always wanted to be a magician. Can remember telling my mom and dad when I was 5, when I grow up, I'm going to be a magician. And they were excited, got me a magic set when I was 7. But when you graduate and you're 21 and you call home and say, hey, I think I'm going to be a magician, it isn't quite the same reaction that you get when you're 5, but they were very supportive, and it turned into a pretty amazing career for me. We were named 2009 and 2015 International Magicians of the Year, and we were Performing Arts Entertainers of the Year for 6 consecutive years before we decided to retire, kind of at the peak of our career in 2015, to focus on the work that we do in our nonprofit. As an arts advocate, we often talk about the power of the arts to transform, inspire, challenge, build community. But for the past several years, since I retired, it's been an interesting place for me because I live with one foot in the arts, which is an interesting world, and one foot in academia, which is also an interesting world. Academics are all about objectivity and data, and artists are all about subjectivity and emotion. Academics want to measure everything. You want to know how the arts influence somebody's life. And I need to see that in charts and formulas and graphs. And when you say that to an artist, the hair on the back of our neck goes up just a little bit. Because in the arts, we look at everything as subjective. It's qualitative. It can't be measured. It's individualistic. Everybody experiences art in a different way, which kind of leads me to that question of what is art? And I've had this conversation with many of you already, because in our culture, we really take arts for granted. And we think of it as a place you go. I am going to go and see art. I'm going to go to the theater. I'm going to go to the museum. We go someplace and see art. But in the other cultures that I work in, Turkey, Russia, throughout parts of Europe, art is so woven into their society that in Russia, for instance, they have every community of any size has a youth theater, a circus theater, a drama house, an orchestra hall. I mean, art is so important to every aspect of their life. In the US, we've gotten to a place where we just accept it, when literally we are surrounded by art. Everything that we have, the clothes that we wear, the glasses that we have, the coffee cups that we use, these are all somebody's creative expression. So we are so surrounded by art every single day. Sometimes those of us in the health professions forget the role the arts can play in promoting and protecting human health. I've had the privilege of working in education and medical research for about 15 years, and have published, I don't know, 13 or 14 articles in both qualitative and quantitative in peer-reviewed journals, specifically on the therapeutic benefits of magic tricks in a clinical setting. My work is focused primarily on the benefits of learning and performing magic tricks to impact change in the lives of people with disabilities. That's where I focus. And I mostly work with autism, trauma, and emotional behavior disorders, though I also do a lot of work with just developmental and intellectual disabilities. I think sometimes people have the wrong idea about magic. They think of it like a comic book, where a guy in a cape twirls his mustache, throws his hands, there's this giant puff of smoke, and something magical happens on the stage. Which is why I love coming to places like this, where no cape, no mustache. I tried to get smoke machines under the table, but we just couldn't get that with the fire alarm. So it's nice just to be able to stand here and give a different face to magic. I think those of us who grew up in magic, we know what it's all about. It is the lure of knowing a secret, having a special talent, being able to attract an audience and tell a story and offer something exotic and interesting, like this little box. So when I was growing up, every magic trick looked sort of like this, a fancy painted box. But when we wanted to make it really special, really magical, we'd put dragons on the side. Or we'd paint Chinese characters all over it. Because as a kid who grew up in the South, that meant it came from someplace far, far away. And it had special magical powers. I wanted to show all of you this little box because it reminds me of so many people I've come to know. People with disabilities. The ones who have been placed inside the box by the people around them. The ones who don't quite fit in because as a society, we have already decided the size and the shape of the box so that everybody just fits so nice and neatly on the same size shelf. Of course, for people who work with people with disabilities, we understand that problem. As long as we keep defining this box, only certain things will fit inside. Well, over the last few years, we've been changing that point of view. What exactly is the box? Who exactly is supposed to fit inside? Well, maybe we've had that backwards, twisted, upside down. Maybe it's not about the people at all, but our perspective that changes everything. Sometimes it takes something just that simple to change the way you look at things. And now maybe you understand the appeal of magic, why kids, big kids, little kids, kids like me, find these mysteries to be exotic and interesting. Special and magical. I have learned in my work to look beyond the box, to ignore the obvious containers. But I've also learned that sometimes giving people just a few simple little magic tricks can completely break away the box that surrounds them, giving them an entirely new set of skills and understandings. So for the next few minutes, what I'd like to do is I'd really like to focus on magic, the art of magic, how it connects to what it is that you do. Because magic has a story as old as recorded history. It is probably the oldest of all the performing arts because it so easily translates from one culture to another. We know that cave paintings, about 15,000 years old, are found in southern France and northern Spain and depict images of magicians performing for their villages. The Westcar Papyrus, 3500 BC, has images of magicians performing in the Pharaoh's courts. We know that magicians were an important part of the streets and marketplaces of ancient Rome and Greece. And the oldest magic book in the world is called The Gift of Wonder, written in Persian between 978 and 1135 BC. And it doesn't look at magic from this mystical sort of perspective. The author of this book looked at magic as an art and entertainment form. By the late 1800s, magicians were an important part of society, significant players in the world of theater. If any of you have ever seen Broadway productions like Beauty and the Beast, Mary Poppins, Aladdin, Into the Woods, The Scarlet Pimpernel, Ghost, all of those amazing special effects came out of the brain of a magician. Their problem-solving skills and their creative abilities have contributed some pretty major things to modern society, like the parachute, vending machines, pay toilets. I know. And the technology that we still use to show movies. That was a starving magician who went with the pay toilet, because that's just something everybody had to use. They were often called the scientists of show business, daring, adventurous, willing to attempt new impossibilities with absolutely no guarantees of success. It sounds a lot like you guys. I think magicians and what you do have a lot of commonalities there. They would fit very nicely into this medical world. So, looking at all of that, before we dive in really deep, not really deep, but into some things that I think are going to be important for you, I think it's really important to address this common idea around what magic therapy is, because that's an interesting title, Magic Therapy for Sedation. That's always the first question I get is, what are you even talking about? And this lack of a common language can be really, really confusing. If you look at the literature, and a lot of it is mine, but if you look at the literature, you see that magic is used in a lot of different ways with different clients. And it's always called magic therapy, despite the fact that the applications are very, very different. And when there's not a clear explanation of what it is, a clear description, then we get really confused on its purpose. And that can encourage disparities in the way we learn or teach or use this kind of approach. Magic tricks offer both a passive and an active therapeutic benefit. And so that's where I really want to focus. Watching a magician perform, like you all just did, can be a valuable distraction that aids in the reduction of anxiety, builds rapport and trust, increases environmental mastery, allows for choice and autonomy, and improves affect and self-concept in children and adolescents. But when we teach magic tricks to someone, an active therapeutic approach, which is a lot of what I do, when we teach it to help with a specific diagnosis, that's when it becomes this active therapeutic approach. And we've used that to improve cognition, motor skills, communication, social skills, and creative thinking or flexibility. So within that context, magic therapy is defined as a carefully designed, systematic approach to the therapeutic use of magic tricks in a clinical setting. It requires training, evaluation. You want to make sure it's done with fidelity and competence. And there's considerable evidence that kind of supports that. Fieldwork and research on magic trick integration for traumatic brain injuries won first poster prize at the Canadian Association of Physical Medicine and Rehabilitation. Research using magic as an intervention for mental health diagnoses won first poster prize in Hong Kong at the International Mental Health Conference. Research using magic tricks as a hand-arm bimanual intensive therapy program for kids with hemiplegia won first poster prize at the European Academy of Childhood Disabilities Conference. And we also explored magic with autism, developmental and intellectual disabilities, a lot of different disorders. Based on that research, the American Occupational Therapy Association supports the use of magic tricks as an authentic method of achieving therapeutic goals. And today this project, which we simply call Magic Therapy, is being used in about 2,000 hospitals and rehab centers in 30 countries around the world. And this all started because I had a really horrible automobile accident with a traumatic brain injury and a lower spinal cord injury. Spent about a year in the hospital, and it was magic that became my motivating force to get back on the stage. So working with a number of therapists, we pulled this all together. And I would have never thought that out of such a tragic accident, something so impactful would have happened. Now, because I work in the entertainment industry, we do everything by video, right? If you want to explain this to somebody, we say, oh, we've got a promo video for that. You can imagine the leap this was as I'm starting to try to talk to medical professionals about the value of magic tricks in all of these different areas. And so for me, I thought, I'll make a video. And so I had all of this video footage of clients that I'd worked with, and with their permission, I submitted that to a very good friend of mine, and I produced a short documentary called Powerful Medicine, Simply Magic. It's really short, 22 minutes long. I'm not going to show it to you. If anybody wants to see that, you can send me an email. I'll send you the link. But it's called Powerful Medicine, Simply Magic. I gave it to this friend of mine whose name is in the bottom quarter there, Mwita Chacha. Isn't that a great name? He's from Tanzania. His middle name is Timothy, but we don't call him that. It's Mwita Chacha. I gave this all to Mwita, and he called me on the phone. I was looking for a 2-minute video that I could show to people like you and say, hey, this is what this is all about. He called me back, and he said, I think there's a film here. I think there's a short documentary here. So we put this all together and threw it out to some film festivals. Now, this is very medically based, so we were thinking, the general community is not going to be interested. To date, the film has won 18 Best Short Documentary Awards, including the International Humanitarian Platinum Award given by the United Nations. And it all focuses on the therapeutic aspects of magic tricks in a clinical setting. I want to introduce you to one of the little guys in this. His name is Tristan. He's from the United Kingdom. He has hemiplegia. Had never met anybody else with hemiplegia, and we put together this summer magic camp program, and he was a part of that. And when he came into the room, 9 years old, he walks into the room and he sees 25 other kids just like him. And he looks up at his mom and he said, Mom, I'm not alone in the world. It was a powerful recognition for him. After the first week in the camp, he took his mom by her hand with his affected arm, and he said, Mom, I don't think you're going to have to take care of me for the rest of my life. So this is Tristan.
They always say, like, why do you have a broken hand? They always say that. I don't have a broken hand, do I? It's just hemiplegia, isn't it? Welcome to the magic show. I am going to make the ball drop through the cup.
Pretty amazing kid. The resilience, the persistence, the perseverance, the motivation, that's what we found that magic does, is it motivated our clients to move more quickly through some of the challenges that they found. The majority of my work is focused on working with occupational therapists, speech-language pathologists, physical therapists, rehab specialists on using magic tricks as a very active therapeutic approach. That doesn't mean that I don't see the value in that passive approach to magic, which is where I really want to focus. I believe in the effectiveness of using magic tricks because the art of illusion has the ability to capture and hold the attention of people of all ages. Everybody is intrigued by the seeming impossibility of a magic trick. Let me show you what I mean. One more time. I'm going to need some help with this one. And I promise it's not a saw. All right, let's see. I have some ropes. How about, where's my guy from Brazil? Hey, how's it going? You can just catch this one for me? Perfect. And we'll go with we're going to hit our international folks. Let's go to Greece. Excellent. Thank you, Demetrius. And where's our turkey guy? All right, Eunice, here you go. All right, so the first thing people think when you're a magician is everything you use is gimmicked, right? Everything we use has to, so I want you to check these out. I want you to grab the ropes, pull them by the ends. If you could stand up for me so everybody can see you. Yep. So grab the ends of the rope, pull, show everybody they're solid pieces of rope. They don't stretch. They don't separate. You have the biggest one there. Make sure it's not a bunch of little pieces of rope all hooked together. Good. Pretty solid? Okay, look at the ends. What's on the ends of the rope? Tape. Why do you think we put tape on the ends of the rope? Yes, so it doesn't unravel, because it would this be ugly, and life is too short to do magic tricks with ugly ropes. So other than that, are they pretty good? Yep. Okay. Toss it back. You can throw it back to me. So we have 3 soft white cotton pieces of rope. They don't stretch. They don't separate. The ends have been cut and bound with tape so they don't unravel. They're exactly the same. It would be difficult to tell these 3 ropes apart, except for one thing. What is that? Size. Right. I knew you'd recognize that. Because our brains are hardwired, right? Psychologists tell us our brains are hardwired to look for those differences, to find the differences, and then to label our experiences according to those differences. So in really simple terms, I have a long rope, a medium-sized rope, and a short rope. Now watch, because I'm not going to do anything tricky here. I'm going to take the short end of the rope and bring it up to the short end, just like that. The medium end of the rope up to the medium end. The long end of the rope up to the long end. Pretty simple. Now if I were to walk in the room and show you this, you might think all of these ropes were the same size. They're not, but you might think they were until you saw this. And then you go, oh, no, yeah, those are messed up. Or we could just do this. And then you end up with 1 medium-sized piece of rope, 2 medium-sized pieces of rope, or 3 medium-sized pieces of rope. Now, this isn't a good trick unless you can pull these back through your hand and pull out 1 short piece of rope, 1 medium-sized piece of rope, and 1 long piece of rope. So, thank you. Now, I know what you saw, but let me tell you what I saw. So as soon as I brought the ropes out, everybody sat up a little bit taller in their seats. And when I passed the ropes out to people and I was asking them to pull on the ropes, you were all vicariously living through that experience. You were looking at this guy like, if he had given me that rope, I'd be pulling harder. I mean, you're like, just pull hard. I know there's got to be something about that rope. But when the magic starts to happen, when I start to bring the ends up, you all very slightly lean into me. And then when the magic happens, Demetrius' head goes like this. Like, what was that? And when they all come back to the 3 ropes, your body's kind of relaxed a little bit, and you go, wow, that was really cool. That's that experience that happens with the magic trick. Imagine that sort of experience happening with your clients on a completely different level. So this technique can be really empowering, not just to your clients, but also empowering for you. I chose this picture because I knew there were going to be dentists here. And I also chose it because this is what I look like still every time I go to the dentist. So I thought, yes, this is me. We know that there are lots of factors that influence anxiety in pediatric clients. That anticipation of pain, bingo for me. That fear of separation from their parents, a loss of control, unfamiliar routines, medical procedures and instruments, all of those things can lead to anxiety. There are several studies that cite the use of humor to help children relax, gain a sense of control, increase cooperative behaviors. Humor is now classified as a nursing intervention, which I think is awesome, to help people cope with difficulties experienced as a result of illness or hospitalization. On my way here, my Uber driver, when he picked me up, it's always hard to explain what I do. And so we started into this conversation. Oh, what brings you to town? Oh, I'm here for a conference. Oh, what's the conference? And so I told him, and he goes, oh, so you're what, an anesthesiologist? And it's like, not really. What do you do? I'm a magician, which you can only imagine goes into a whole other sort of thing. And when he let me off at the hotel, he goes, I can't wait to tell people that I had Patch Adams in my car. So it's like, all right. So humor is important, and I'm certain that many of you already integrate some humor into your practice. If you haven't, you should. And if you don't, it's because you don't think that you're a very funny person, which is why you should learn some magic tricks, because that can help you with that. Humor combined with magic creates this really powerful synergy, and I believe is an effective non-pharmacologic sedation technique. Humor and magic can serve as an effective distraction tool. Did I just lose my mic again? Am I still good? I'm good? Sorry. It can serve as an effective distraction tool by creating this sense of wonder, amazement, laughter, especially in a place where it doesn't typically exist. I can remember one of the first times I ever worked at St. Jude, and I have such a wonderful relationship with the folks in St. Jude, both in Huntsville and in Memphis, and an open invitation to kind of just stop by anytime, which is pretty awesome for me. And I can remember being at the facility in Huntsville, working with kids that were taking chemo, and we were having a blast in the chemo room, which just really also doesn't happen very often. And at one point, the nurse stopped by and stuck her head in the room, and she's like, what is going on in here? And this one kid, chips up and he goes, "We're learning magic tricks." And she looked at me and she goes, "I've never heard any kind of laughter coming out of the chemo room." So I just had to make sure I knew what was going on in here. So let's look at some of the 5 things that we talked about at the very beginning. And first thing I want to look at is magic's ability to aid in the reduction of anxiety. There are several studies that address this concept, but I want to bring 2 of these to your attention. The first was a randomized trial that was conducted in Italy. The study compared the preoperative anxiety level of 2 groups of children undergoing outpatient surgical procedures. The first group, the control group, only had their parent with them while waiting for surgery, who then went with them into the induction room. But the second group had a clown or a magician with them, who spent only about 15 minutes with them in the preoperative waiting room. The performers used a variety of methods, including humor and magic tricks. And when the nurse took the child and the parent to the induction room, the clown or the magician went with them for that process. The findings of that study indicate that the control group experienced an increased level of anxiety in the induction room compared to the waiting room. But the children who had the clown or the magician present with them, they demonstrated a significantly less preoperative anxiety during the induction process. There were some limitations to the study, but overall, the presence of the magician in the room with the child significantly reduced their anxiety level. A second study was done in a pediatric hospital, university hospital in the Northeast. The control group and the intervention group were randomly assigned from children who volunteered from the ward. Prior to the study, a group of medical students, this guy standing up there is a magician and a doctor, and we worked together to train all of these medical students to deliver some simple magic tricks, but we also wanted to deliver them competently, right? Magic is about being able to do the magic. If you just do the moves and it's not a magic trick, you can imagine it's not very effective. It might be humorous, but it's not really great magic. So how to competently deliver those and how to teach them to the children. After a baseline anxiety survey of both groups, the intervention group participated in about 15 minutes of a magic-themed activity, which included the medical student performing 3 or 4 magic tricks and then teaching one of those tricks to the child. And then they were given a follow-up anxiety survey after about 3 minutes after the intervention. The control group did not engage in the magic-themed activity at all, and about 30 minutes later they were administered the anxiety survey. There were no significant results in those 2 groups from the beginning. Within the magic intervention group, there were significant percentage decreases in pre-intervention to post-intervention measures, a decrease in anxiety of 25%. The findings of the study found that suggested that using a magic-themed activity with a pediatric client may significantly reduce inpatient anxiety in the immediate time period, but those results lasted for up to an hour after they participated in the activity. So passively, magic was a pretty cool sort of way to go. The other thing is about building rapport and trust.
That's what one of the things in talking to all of you last night, this morning, it's the big thing that I hear so much is building that rapport and trust with a client. Being a magician is about more than simply being able to execute the moves to the trick. You have to be able, your audience has to like you. And I know it's probably not a correct way to say your audience is your patients. That is your audience. And they need to like you. They need to feel like they are connected to you. I used to end my illusion show with an underwater escape. It was awesome. It was terrifying. Audiences were on the edge of their seat. But it would have never worked at the beginning of my show. Because at the beginning of the show, the audience hadn't decided whether or not they liked me. And liking me had a lot to do with whether they were concerned whether I died or not in the tank. So if you don't have that relationship with your audience, then it's pretty tough. Performing a simple magic trick can make you relatable and relational to your client. It can also help with this increased environmental mastery. You can increase the degree to which your clients feel competent to meet the demands of the environment that they're in. Control and confidence, a capacity to cope, adjust and adapt to the situation, and decrease their levels of skill. And you can do that in one of three ways: showing them a magic trick, asking them to assist you with a magic trick, or teaching them a magic trick. All three ways will work. This one is all about choice and autonomy. In a situation where they rarely make any choices of their own, giving them an opportunity to learn a magic trick and say, hey, pick 2 paper clips that you want. Pick whatever color paper clips. Giving them any sort of control of where they are in that particular moment. And finally, looking at magic tricks to improve affect and self-concept. Your client's emotional state is often very, very evident. And I had a conversation with somebody this morning just talking about, because I work in the disability community, often with people who are nonverbal or pre-verbal, how you manage that, how challenging it must be to come in and work with a client with a disability and understand what they're feeling, what they're trying to communicate to you, and for them trying to understand what you're trying to communicate to them. What I have learned is, regardless of the disability, they're always very, very present, and there are always ways of communicating. You can shift that emotional state from being anxious to being more relaxed simply by engaging them in a magic trick. You've probably seen this video. I love this video. This is all the dentists in the room are kind of shaking their head. This is such a great video. Dr. Shimshi is a dentist in New Jersey, and this video went viral of him just doing a few little magic tricks with one of his pediatric clients. Priceless. So where does that take us? Well, hopefully there's something that you can pull away from this today. Learning magic tricks is not time consuming. It's absolutely affordable. It requires very little effort on your part. You don't have to be a magician, but the benefits are huge. And you don't have to sit down. You don't have to go to a magic shop and buy a bunch of magic tricks. If there's one thing that I learned in the pandemic, I created an entirely new protocol of magic tricks that use everyday common items, things that you have around the house. So one of the things we're going to be looking at in the 12 o'clock workshop is teaching you magic tricks that just use everything that you've already got around your hospital or your office. Now, if you want to be more magical, you can definitely go to a magic shop and buy some little things. I've got some little prop things that we're going to give away today. But there are lots of opportunities for you to be able to engage magic either passively or actively in your practice. So if you have any questions, if you're not going to make it to the session at noon, please please drop me an email. I have a whole list with videos, instructional videos, where if you're like, oh, I need to learn how to do this. Perfect. Here's a video for that. I can send you all those videos. They're step by step. They're super, super easy to do. We're not quite done yet. At your table, you probably, when you sit down, you have a card, an envelope. Everybody pick that envelope up. I know. I didn't think about when I put these on the seats that people thinking that they were reserved. So I saw people walking around going, oh, all of these seats are reserved. I'm not sure where to sit. Sorry about that confusion. Bad on my part. So if you've got your envelope, just go ahead and tear it open and dump out the contents for me. You should have 4 playing cards. I'm not guaranteeing it's a good hand, but you should have 4 playing cards. Yes? All right. And are they all different? Like you don't have 2 4 of diamonds, or they should all be different. Okay, good. Now what I want you to do is turn them over so you can't see them. And I want you to just shuffle them up in your hand, mess up the order so that you don't know where the cards are. Great. All right. Now I want you to take the cards and long ways like this. I want you to fold the cards in half. And I want you to crease them right down the middle like that. Put a really good crease there. Good. Now don't let these pop out of your hands. But now I want you to open them back up. And all I want you to do is just to break them like this. Just go back and forth until that crease is really weak. All right? Now that you've done that, all I want you to do is to tear the cards in half. Don't drop them. Keep them both halves in your hands. Tear them in half. And I know we've been in the pandemic for 2 years and we haven't been going to the gym, but if you can't tear these in half, it's time to pick your gym membership back up again. All right? So you've got 2 stacks. Yes? Did you make it? Okay, good. So put 1 stack in each hand. You have a choice here. You can put the stack on the top or on the bottom. So you make the choice. Just put them together. All right? Now hold those in your hand. And you're not looking at the cards. Yeah, just 1 pile right on top like that. Yes, matching the corners. There you go. Thank you. All right. Everybody there? Good. Now reach down and I want you to count off the top 3 cards. 1, 2, 3. I want you to take those cards and put them somewhere in the middle of the stack. Not on the top, not on the bottom. Just put them somewhere in the middle of the stack. And when you've got that, raise your hand. Yeah, all together. Just slide them right into the middle of the stack. Good. When you got that, raise your hand. Excellent. Now I want you to take the top card and push it right under your thigh. Your thigh. All right, when you've got that hand in the air, excellent. Now we're going to count off the top 3 cards. 1, 2, 3. We don't need those cards. We're just going to throw those off to the side. Good. Hand in the air. Excellent. Take your top card. Swap it with your neighbor. When you've got that card, slide it somewhere in the middle of your stack. Not on the top, not on the bottom, somewhere in the middle. And make sure you're looking at the backs of the cards, not the fronts of the cards. Good. Hands in the air. Count off the top 3 cards. 1, 2, 3. These cards, we don't need. You can toss those off to the side. So you have 1 card in your hand, 1 card under your thigh. Don't look. What I want you to do, though, is just take the card from under your thigh. Don't look at it. And I want you to bring them together like this and see if they look like they match. All right, now I'm going to count to 3. And when I count to 3, I want you to turn the cards over. And if your card matches, I want you to stand up. Ready? 1, 2, 3. Nicely done. Very good. Thank you. You can take a seat. That was awesome. I can tell already this morning you're going to be good at following directions. So my workshop at noon, we shouldn't have any trouble at all.
thank you so much. I know I rushed through a lot of information, but thank you so much for today. I really, really appreciate it. Thank you.